Yeah, so I mean, I think it's important for all patients to go on a clinical trial. The reason being that the outcomes, despite the 4 drug approvals that we had in 2017, the outcomes for these patients remain really very suboptimal. I mean, we're making these incremental gains, which are important. So when I present this to my patients, I say it exactly like that. I say, we have a standard of care, such as something like azacitidine. Well, let's talk about decitabine, which produces a complete remission in 17.8% of patients who are treated. Median overall survival, I believe, of 7.7 months. And we need to do better than that. So in those patients, I encourage them to go on trials that might combine the standard of care with something novel. Certainly in the relapsed and refractory setting, where patients really have not very good treatment options, I encourage them to go on trials of novel agents, either in combination with standard of care or with other things. And the truth is that in my practice, it's not a big, patients are willing to go on trials and they're sort of excited about going on trials. I think what patients don't tend to like is when you've got a randomized placebo-controlled trial. That's always a problem. Luckily, most of the trials I do are not placebo-controlled, so I can say honestly the patients are getting the active drug.